A glosectomy is the surgery done to remove part of or all of the tongue. Glosectomy, less than 1/2 tongue. Hemiglossectomy. The physician makes incisions around the portion of the tongue to be removed and extends the incisions through the thickness of the tongue. Scalpels, scissors, electrocautery, or lasers may be used. The diseased portion is removed. After obtaining good hemostasis, controlled bleeding, the tongue is sutured closed to repair the surgical wound. Glosectomy, partial, with unilateral radical neck dissection. Radical neck dissection is also done to remove lymph nodes, muscles, blood vessels, and other tissue from one side of the neck. Glosectomy, complete or total, with or without tracheostomy, without radical neck dissection. The physician makes incisions through the thickness of the tongue. Scalpels, scissors, electrocautery, or lasers may be used. The tongue is removed. A tracheostomy may be performed. An incision is made in the front of the neck below the larynx. The physician dissects the tissues down to the trachea. An incision is made through the tracheal wall and an artificial airway is inserted, which extends out of the neck. Glosectomy, complete or total, with or without tracheostomy, with unilateral radical neck dissection. Unilateral radical neck dissection is also performed to remove lymph nodes, muscles, blood vessels, and other tissues from one side of the neck. Glosectomy, composite procedure with resection floor of mouth and mandibular resection, without radical neck dissection. The affected tissue of the mouth floor is removed with a scalpel and the diseased portion of the mandible is also accessed and resected. After removal of the diseased section, continuity of the mandible is re-established. The skin and mucosal incisions are repaired with layered sutures. Glosectomy, composite procedure with resection floor of mouth, with suprahyoid neck dissection. A glosectomy with resection of the floor of the mouth is done and lymph nodes and other soft tissue are removed from between the floor of the mouth and the hyoid bone for a suprahyoid neck dissection, without mandible resection. Glosectomy, composite procedure with resection floor of mouth, mandibular resection, and radical neck dissection, commando type. A radical neck dissection is performed and lymph nodes, muscles, blood vessels, and other tissue are removed from one side of the neck. Gingivectomy is a dental procedure in which a dentist or oral surgeon cuts away part of the gums in the mouth, the gingiva. Gingivectomy, excision gingiva, each quadrant. The physician excises the overgrown gingiva using a scalpel, electrocautery, or a laser. Periodontal dressing or packing is often placed. Incision of labial frenum, frenotomy. The physician performs a frenotomy by incising the labial frenum. The labial frenum is a connecting fold of mucous membrane that joins the lip to the gums at the inside mid-center. This procedure is often performed to release tension on the frenum and surrounding tissues. The frenum is simply incised and not removed. Incision of lingual frenum, frenotomy. The physician makes an incision in the lingual frenum, freeing the tongue and allowing greater range of motion. The lingual frenum is the connecting fold or membrane under the tongue that attaches it to the floor of the mouth. Sutures may be placed. The frenum is simply incised and not removed. Tonsillectomy, primary or secondary, under age 12. Age 12 or over. The physician removes the tonsils by grasping the tonsil with a tonsil clamp and dissecting the capsule of the tonsil. The tonsil is removed. Bleeding vessels are clamped and tied. Bleeding may also be controlled using silver nitrate and gauze packing. Tonsillectomy and Adenoidectomy, under age 12. Age 12 or over. Using a mirror or nasopharyngoscope for visualization, the physician uses an adenotome or a curette and basket punch to excise the adenoids.